Institute at the University of the Rio de Janeiro State. Please welcome the chair and co-chair to the platform and lead the session.
Good afternoon. I think the challenge now will be making everybody stay awake after this very nice lunch. I have the pleasure to invite the other speakers to be here. Dr. Gulin is already on my side, Dr. Gandua Sinji, and Dr. Christine Cole. Dr. Sinji is from WHO, Minister of Health, sorry, Gulin is WHO, is from Minister of Health in Mongolia, and will be part of the panel. I think we're going to start. Everybody's already here. The session is about HRH governance and leadership. So health governance or leadership capacity at national level and other levels is considered fundamental in order to health development efforts to succeed. Issues of coordination, stewardship, and steering of the health agenda in a systematic and coherent way can only be addressed with strong and effective health governance. In a similar manner, the capacity to govern the health workforce agenda in the country for effective service delivery is crucial, especially in the context of shortages of qualified health workers, as we saw in this morning. While many countries are making great strides in providing the required leadership, it's clear from field visits and from the case studies and the discussions that health workforce interventions remain fragmented, not only within the Ministry of Health, but also with the related sectors that influence the availability and performance of the health workforce. This session will emphasize the importance and elements of governance and leadership capacities in addressing health workforce challenges in countries, looking at HRH policy and planning process and governance leadership capacities. The strategic vision in addressing HRH challenges is critical and can be explored through formulation of strategic policy directions. The implementation of policy directions and policies depends on capacities, which cover both institutional and individual capacities. The sustainability of these efforts depends on many factors. The session will review some of these factors, such as high-level commitment and policy dialogue. So, in summary, the aim of this session is to share good practice and existing strategies to address HRH challenges and to identify bottlenecks and improving governance for HRH and strategies to overcome the bottlenecks. So we start with Gulin Gedik, that is the team leader of HRH at the WHO office in the West Pacific region. She's going to talk to us about the issues and challenges on leadership and governance capacities. Gulin, please.
Thank you very much, Mario. Good afternoon.
Gulin, I think your mic is, you need to move, yes. Perfect. Thank you.
Good afternoon. I think this session is continuation of our morning session. We have touched quite a number of issues related to health workforce leadership in the morning, and especially collaboration, multi-sectoral involvement. I will continue and take it from the morning session to talk about a little bit about health workforce governance and governance capacities. Nowadays, we are talking about universal health coverage. The World Health Report 2010 brought the importance of universal health coverage once more to the health agenda. And these days, we are talking about post-2015. We cannot say that MDGs have been fully achieved in all countries. The challenge of achieving MDGs will continue in some countries, but also we are discussing what would be the health agenda after 2015. And universal health coverage is coming out one of the issues, one of the targets in post-15 discussions. And when we talk about universal health coverage, we are talking about that all people obtain health services they need without the risk of severe financial burden. So we are emphasizing two aspects: financial coverage, financial risk protection, but also there is an important aspect with services. And especially in Asia-Pacific region, most countries are gradually graduating to middle income. Most countries are already in middle income countries, and some of the low-income countries are gradually graduating into middle-income countries. And most middle-income countries are facing the challenges of equity, quality and safety, of course expansion of risk protection, but also improving the service delivery. When we talk about access to service delivery, when we talk about improving the health services, the key factor, key challenge is coming up with the human resources for health. And in the morning, we have seen that we are facing a lot of challenges with human resources for health. These are not new challenges: shortages, distribution problems, skill mix imbalances, poor working environments. All these challenges are the challenges that we have been dealing over the last couple of decades, and we are still dealing with this unfinished agenda. And we are also getting new challenges. So we need to explore ways of addressing these challenges in new ways, in innovative ways. And we need health workforce leadership and governance capacity to ensure continuous supply and availability of appropriate mix of health workforce for quality service delivery, to promote the optimal use of available health workforce, and to attract and retain qualified health workers. When we talk about HRH governance, there are many aspects, many dimensions of it. Some of them came up in the morning, and some of them we may discuss a bit further in this session.